Hello y'all, welcome to the Miss Mitochondria channel where we talk about health, biology, and medical topics. So today I want to talk about spinal curvatures and the different types. So there are three types of spinal curvatures and I actually have one of them. In case you didn't know, I do have scoliosis. So there are three types of spinal curvatures, like I said, right? One of them is called lordosis. This is a curve this is a abnormal curve in your lower back. So we normally, if you have a perfect spine, you have a slight curve in your lower back. You know, that's how your booty sticks out a little bit and, that kind of thing. It's basically your tailbone, right? But if you have lordosis, your tailbone kind of curves inward more, which kind of makes your lower body poke out more, if that makes sense. And then there's kyphosis, which this is a curve in your upper back. This is usually called humpback, although we're not going to call it that because we're professional here, okay? It is kyphosis. If you see somebody with a humpback, it is kyphosis, all right? Don't be mean. And then, of course, there's the most commonly known one that everybody gets tested for in middle school and all that kind of thing, because that's the common age to get it, or the common age where it's caught anyway, and the common age that it's treated. Okay, so that's scoliosis, right? And scoliosis is a lateral curve or sideways curve that can either be S-shaped or C-shaped. Now, me personally, when I was first diagnosed with scoliosis, I think I was 16. And then again at 18, I had it looked at again because I was trying to join the military, right? Which I didn't get in, by the way. Anyway, it was back then my spine was C-shaped, okay? But like a year or two ago, when I got it looked at again, just to see where my back was, I think it was last year, my spine is now an S-shaped, so that's great. The reason I didn't get any surgery or anything like that was because my insurance when I was a teenager would not cover it, because they consider it cosmetic, especially if you have it done when you're a teenager, because I guess they just think your back is going to get better as you grow older, and it doesn't. But anyway, and then of course, if you want to get a little more complicated, there's the different areas of your spine that you can have the curves. There's your cervical region, which is your neck, the back of your neck, thoracic, which is your chest area, or kind of like between your shoulder blades. And then you have your lumbar, which is basically what you would think of as your back, like basically your shoulder blades to your, we'll say, waist. That's your lumbar region. And then there's your sacral region, which is your very lower back and your tailbone, or coccyx, is if you want to get all scientific and stuff. So those are the four sections that you can get a curvature in. Now, these curvatures are usually genetic. Okay, so if somebody tells you, oh, you need to sit up straight or you're gonna get scoliosis, no. That's not how it works. Because believe it or not, our spines are actually very strong. They're delicate. They can't be damaged, because you could damage the whole human, but our spines are actually very strong. So doing something like slouching or something like that is not going to give you scoliosis. It might give you bad posture, which that's more of a muscular thing. That's not the actual spine, okay? So, to fix any of these spinal curvatures, the most common way is surgery, and they've kind of started doing things a little bit less invasive now. They got like laser surgery and all this fancy stuff now. And they probably still on occasion do it the traditional way, where they do a complete slit down your back and do the wires and the rods and whatever. They still do all that stuff, but the most common age to get the scoliosis surgery is when you're a teenager. And the problem is, and they usually don't do it if you're not still growing. Like if you're done growing, they're like, there's really nothing we can do for you, or something like that. Usually if it's bad enough, they'll do surgery, or they might tell you if it's caught early enough, like say you're 10, 11, 12, they might give you a brace to straighten everything out, because you're still growing, and you put the brace on and you should grow straight if you wear it properly. Of course, you have to wear it properly. It's kind of like braces on your teeth. You wear them properly, you take care of them, you get things adjusted sometimes, and you should be fine, right? Another thing that can be done is chiropractic health to treat it. Now, here's my dilemma with chiropractic health. Some chiropractors will claim that they can straighten your spine, and that is sometimes very misleading. In order to really, really straighten your spine, which again, it's highly unlikely that they can actually straighten your spine, can they reduce pain? Can they keep it from getting worse? Yes. Okay, that's if you go to a good chiropractor. Believe me, they're not all the same. Even if you went to a chiropractor every single day for, let's say, 5 years, your spine is not going to be straight. It's just, I don't know. I mean, if you have scoliosis or something and you have a different story, let us know in the comments. But most of the time, they cannot straighten your spine, no matter how many times you go to them and how long you go to them. But like I said, it can prevent it from getting worse. Like I go to a chiropractor. And massage is really good too. Don't knock the idea of massage, because massage, although it doesn't do anything for your spine per se, it does help the muscles around it. And if you get massage, now disclaimer, I am not diagnosing anything, I'm not recommending any kind of treatment here, but in my experience, okay, just telling you guys my experience, I get massages on occasion, and I do go to the chiropractor, and the combination of both of those really helps my back, because the massage helps with the muscles and keeps everything relaxed and flowing and moving, and the muscles don't stay stagnant in one place. And then the chiropractor works on the actual spine. So the combination of the two is really awesome. Okay. And then there's something, I don't know too much about this, to be honest with you, but there is a therapy out there called Scruff Therapy. It's for, I don't know if it can be used on Lordosis or Kyphosis, but I've seen people, a lot of people use it for scoliosis therapy. You know what? Give me 1 second and I'll look it up. Okay, I'm back. Okay, so I did look up the Scruff method. Scruff Scroth. I don't know. It's spelled C-H or S-C-H-R-O-T-H. I'll put it on the screen. It says it uses exercises customized for each patient to return the curved spine to a more natural position. The goal of Scruff exercises is to derotate, elongate, and stabilize the spine in a three-dimensional plane. And as I read further, it did say that some people found it very effective, and it's moving kind of away from the surgery, because you know, surgery on your spine, any surgery really is risky, but if you're talking about surgery on your spine, that's especially risky. You know, you could talk about paralysis, death in rare cases. Not to scare you all, I mean, I've never had the surgery myself, because like I said, my insurance wouldn't cover it back then. And my spinal doctor doesn't recommend it now because it's not that bad and I'm not in like chronic pain. But like I said, the massage and the chiropractor help me. So, yeah, a lot of people, basically it's just a type of physical therapy in a way, the Scruff exercises. It's just geared and personalized towards scoliosis. Okay, so yeah, let's see, what is the best therapy for scoliosis? 3 proven treatments of observation, that's just keeping an eye on it, bracing, which I talked about, and surgery. And the thing is after you do get surgery, if you do get surgery, you're still gonna have to go through some physical therapy type stuff, because spinal surgery is not a lightweight surgery. So I mean, you might be in physical therapy for 6 months to a year after, and it all depends. You know, it depends on your age, it depends on how fast you heal from the surgery and all that. Like, you know, I'm in some scoliosis groups on Facebook, and some of the teenagers are like, oh yeah, I had surgery and I was back to cheerleading 3 months later or something like that. I'm like, well, good for you. You know, the thing is, everybody's different. That's what I'm getting at. So anyway, so those are the 3 spinal curvatures. I hope this video helped you. If you want to learn more stuff, and if you like this video, please hit the subscribe button and put your video request in the comments and let me know what you think. And I will see you guys next time.